Terry has this facial puffiness. He's still been feeling like his normal self. He has a normal activity level and a normal appetite. Bowel movements are regular. He stole twice yesterday, which is normal for him. And he's got no sick contacts at home and no recent travel. Okay, so I'm going to tell you a little bit about his past medical history now. He had frequent ear infections as a toddler. No longer has issues with that. And as stated before, he had several bouts of hives and one episode of wheezing about 18 months ago. And he was treated in an ER, sent home. His surgical history, he had a myringotomy at 2 years of age, so 3 years ago, and that kind of helped clear up those the ear problems that he was having. He's currently on no medications, and he has no known drug allergies, and he's up to date on all his immunizations. He has a positive family history for asthma. His older brother has asthma, his younger sister has eczema, and mom has Graves' disease and hypertension. Terry lives with his parents, and he started kindergarten this year. He has a dog, a cat, and a turtle. On review of systems, denies any fevers, fatigue, or change in appetite, or there's no eye drainage, or ear pain, or sore throat. It's just the puffy eyes. Okay, he denies, on cardiovascular exam, denies fatigue with running or syncope. As I said, he's maintained his normal activity level. And there's no respiratory distress or any recent wheezing or coughing. No diarrhea or vomiting, and there's no easy bruising or bleeding, and denies any difficulty with ambulation or joint pain. He's able to run and just fine, and no more rashes, so no rashes, okay? And Dad, just interrupt if I get anything wrong, okay? On physical exam, his vitals, temperature of 37 degrees Celsius, heart rate of 90, respiratory rate of 20, and a BP of 120/78. On physical exam in general, he's alert, cooperative. He was cooperative with the exam. His pupils were equally round and reactive to light. His red reflex was positive bilaterally. He had his oropharynx appears clear. There was no redness. Or no exudate or enlargement. There is mild periorbital edema, which is what his father brought him in for, and the conjunctiva was not injected. It was just read that first day. On cardiovascular exam, S1 and S2 normal, regular rate rhythm, no murmurs, rubs, or gallops, and brisk capillary refill, and 2+ pulses throughout. On respiratory exam, he was clear to auscultation bilaterally and no crackles or wheezes. GI, was soft, his tummy was soft, non-tender, non-distended, and he had normal bowel sounds. No hepatosplenomegaly. On examination of his skin, he had some swelling on the dorsal aspect of his hands and his feet, and there was no rashes noted, and on the GU examination, he had some scrotal edema, but his testes descended bilaterally. On neuro examination, he was alert and oriented ×3. His cranial nerves 1 through 12 all intact. Normal sensation, motor strength 4 of 5. On lab exams, he had CBC and is pending right now, but on urinalysis, he had 4+ protein. And a specific gravity of 1.030, and his chemistry panel was remarkable for protein of 2 grams per deciliter, and he had some low albumin at 1.4 grams per deciliter, and high cholesterol at 350 milligrams per deciliter, and his BUN and creatinine were normal. So, so here we have little Terry here, 5-year-old with nephrotic syndrome, because he has the loss of protein in the urine, he's got the hypoalbuminemia, and he's got the edema. There are several reasons why he could have these things. It could be minimal change disease, it could be angioedema, it could be acute post-streptococcal glomerulonephritis, hence he had an infection 2 weeks ago. And we're going to work these things up and then see what we come up with. But this should resolve with treatment.